In the early days, those who had mental illnesses had much difficulty functioning in daily life because the cause of the disturbances were not understood. These people often ended up in mental hospitals. No one knew how to treat these patients until Sigmund Freud, an Austrian neurologist who founded the method of psychoanalysis. He discovered by conversing with the patient, improvement could be obtained. With this discovery, he is considered the father of modern psychology, and he has helped many of people over the years.
The school recommended it because my counselor thought it'd be good for me to get help outside of school. I was in therapy for 2 years on and off. My therapist recommended me to a psychologist who prescribed me pills that helped me a lot.
Since the early 90s, pharmaceutical companies' profits nearly double every 5 years.
At first I was hesitant to go because I didn't think it would help at all, but then I went and it ended up helping a lot because of the fact that there was someone there listening to you. It's not just someone trying to get answers out of you. It was actually a caring soul, caring person, caring for you. It gave me a support system, somewhere to go when I felt down, and I had my therapist's number all the time, so it was just easy. It depends on who you are. If you have a lot of support at home, you probably don't need it, but if you come from a dysfunctional family, it's pretty great.
I had a lot of difficulties at home, and I just needed to organize my thoughts, and I thought having a therapist would help me do that. I was in therapy for about 3 years. I found that all my problems I had when I began therapy still existed after I had gone to therapy.
On a survey of 100 people about the effectiveness of therapy, 12 people said it did not work, 21 people said it had little effectiveness, and 67 people said that there was a drastic or dramatic change.
You know, I had high hopes going into it, but it wasn't for me. No, it didn't. Yes, even though it didn't work for me, it could work for others.
Clinical psychologist Frances Wilson volunteered to talk on the topic.
I've been a therapist for about 30 years now. I went back to school after having 3 children. I had been a nurse, and I went back to school and got my doctorate degree at that time. The goals for the new patient, this is going to be a frustrating answer, but it really depends on the patient and why they're here. And I ask them, you know, what brought you here? What do you want from therapy? And it's really different for everybody. If I asked anyone that question, the answer would be quite different. But most people want their life to be better. Depends on the person and the degree of distress that they're in. To some degree, it depends on genealogy, because a lot of disorders have to do with genetics, and it has to also do with what's going on in their life at that particular time. Because if a crisis is going on in someone's life with someone who has inherited a predisposition for, say, OCD or depression, then things really pile one on top of the other.
80% of people who went to therapy only went to 8 to 10 sessions. 15% of people went 10 to 20 sessions. And only 5% of people continue to go after 20 sessions.
You know, what's most important in therapy is the relationship between the therapist and who they're seeing. That statistics indicate that that's more important, actually, than level of education. So I think that's really important. I usually have people come in and ask them to come in, why don't we meet for 2 or 3 times and see if it's a good fit? Because I want to avoid really not having improvement. And when things get steady and it feels like we're on a plateau or maybe we're done, I'm in a consultation group every week. So I meet with other doctoral level psychologists, and we, in confidence, nobody knows the names of anybody that we're talking about. We talk about where we are, and I think each of us is a better therapist because we learn from what the other person is doing, and we also get feedback for ourselves that's invaluable. Again, it's different with each person, but I think one of the primary things is the ability to understand the person, because if you don't understand, you can't really help them with things. So empathy is really, really important. My sessions are 50 minutes, and that gives me 10 minutes to write notes and that sort of thing. If someone's in crisis, then I don't stop a session while someone's in the middle of crisis.
From the interviews, one can conclude that therapy comes down to what type of person you are. The outcomes of therapy may be different for different types of people. It may work for some and may not work for others.